Hello everyone. Now I'll show to you some situations that you need to report immediately if we identify some changes in the mental status of the patient. First, we need to introduce ourselves to the patient. Hi, my name is Pablo. Now I evaluate you. So, first of all, I would like to know what's your name.
Maria.
In that case, the name of the patient is not the same as in the patient chart. So this is a sign of some alteration in the mental status, the clear mental status of the patient. Firstly, we need to know that the most aggravating symptom or sign is the alteration of the consciousness of the patient. So for that, we need to continue with the questions. So now, you know what day is today? What the date?
6th of November.
The patient in this case is not 100% sure about the date. So we can ask another questions last. Do you know any member of your family? Do you know any name? Do you know the name of your mother? Do you know where are you now? What are the location? Where is situated?
Par.
In that case, we can see with clearly that the patient does not have consciousness about the situation that she's inserted. So now we can evaluate another signs and symptoms. For the evaluation, we need to check the vital signs of the patient. So in that situation, if the patient have an alteration in the mental status, we will observe alterations in their heart rate or pressure or anything, breathing rate or any other. I will ask for the patient to realize some movements to check the stimuli of the body. So now, Beatrice, can you raise your left arm for me? In that situation, we can observe that the patient does not respond as a normal person. So that's evidence that we need to report to the nurse. Another thing that you can ask for the patient. Beatrice, you can identify the numbers here.
Okay.
In that case, the patient does not remember the number and the patient cannot talk properly. So we have another 2 new evidences that you can report. We can also test the memory of the patient if we have the information previously. Now, Beatrice, can you remember the name of your mother? Can you tell me? The patient does not remember the name of her mother, and as we can observe in this situation, the patient is very sleepiness. That's another sign of alteration in the mental status.